This is Late Night Health. This is the radio and video presentation that cares about the most important part of your life. During the next 15 minutes or so, we're going to spend some time with Dr. Greg Celaya. Dr. Greg Celaya is a functional medicine practitioner. He is a doctor of chiropractic. He has a master's degree. He has several certifications in nutrition, and we're very happy to have him on the program. Dr. Celaya, today's topic is cardiovascular disease and carbohydrates. And I'm assuming you're going to break, at one point or another, you're going to break those carbs down into sugar, right?
Yeah, there you go. Well, happy Tuesday, Mark.
Yeah, go ahead.
Did you know that 2,150 Americans die a day from cardiovascular disease? That's one every 40 seconds.
Oh my. We have a problem.
Yeah, we have a problem. And, over the years, it has decreased, I would say, due to education and perhaps maybe some other reasons, but it's still huge on the spectrum of issues that create a problem for us.
Do you know how cardiovascular disease compares to cancer?
It's right up there. And we definitely have a problem. And one of the big problems that we have is the carbohydrates. Carbohydrates lead to obesity, they lead to diabetes, they lead to insulin resistance, metabolic syndrome, lipid issues as well. And so,
go ahead.
So, all those are huge when it comes to cardiovascular disease.
I was talking to somebody the other day, and he told me quite simply that he's had a couple of bypasses, or as he calls them, he's been roto-rooted 2 or 3 times because his arteries have clogged. Now, these are 30 to 40 years apart. I have to point that out. He is in his 90s. Is that something we should be concerned around, the plaque building in our arteries? And is that due to fat or carbohydrates?
Well, that's an interesting question, because we've been sold a bill of goods for a long time now that fats are the cause of cardiovascular disease, and it's not. It's carbohydrate, it's sugars, it's inflammation. And fats, if you're eating the right fats, don't create those problems to occur. And we can get into the lab testing, but the lab testing that most doctors do for cardiovascular disease is 1970s technology. So they're looking at cholesterol, and the biggest problem I have with patients is they have to get over cholesterol being the issue, because it's not. Your body's made of cholesterol. In fact, your brain has a huge amount of cholesterol and fat in it, and also hormones and cell membranes. It goes on and on. So fats aren't the problem unless you're eating trans fats, which are a real big problem. And they're a man-made fat. Well, there is a small amount that occur in nature, but most of it is a man-made fat, where they take a polyunsaturated fat and they bubble hydrogen through it and create what they call a trans fat.
Which is like a Crisco oil.
Yeah, yes and no. They take an oil, and it could be simply any type of polyunsaturated fat or a canola, and they bubble hydrogen through it to try and give it more of a solid feeling to it, like some of these margarines. Not all of them, but some of them.
Right.
And so therefore they give it a little bit more of a solidity, but not so hard like a butter that's a saturated fat.
Is saturated fat good, or in moderation?
Everything's in moderation. They did 20 randomized controlled trials where they had an issue with carbs causing cardiovascular disease, and not fats.
Interesting. I think that there are a number of oils that I either use or would like to use. For example, avocado oil. I like the taste of avocado oil.
Well, and avocado oil is great. It's a great monounsaturated fat, and it's great. It's got a good smoke point. So what happens is with smoke points, and people have probably heard us talk about smoke points, but when you're cooking a fat, you want to make sure that fat is somewhat saturated. And either a saturated fat or a monounsaturated fat doesn't oxidize as easy. And when an oil oxidizes, it creates inflammation in our bodies.
Interesting. Other fats that would be good for us, I'm just thinking olive oil.
Olive oil is great. Another monounsaturated fat. So, I mean, there's wonderful fats out there. You've got the saturated fats, you've got the monounsaturated fats, and the polyunsaturated fats, which include the omega-3s and the omega-6s. And there's probably a whole nother conversation we should have. But omega-6s are everywhere. They're in just about every food that we eat.
The thought that vegetable fats are better for us than animal fats, is that true or not?
Well, it depends upon where you get the fats from. So, for example, if it's just your conventionally grown meat, we have a problem with that because what do they feed the meat, right? The animal. They usually feed it grain, and what that does is it changes the omega-6 to omega-3 ratios within that meat to be unhealthy, and it creates more inflammation. So if you take a cow, so to speak, and you grass feed it, and you make sure it's organic so you don't have any other hormone or pesticide issues, it is very healthy, way more healthy in comparison to the conventionally grown meat.
Right. What about chicken and turkey, poultry in general? I was reading an article the other day that said, we tend to eat more breasts than we do thighs and legs. And I personally prefer thighs and legs.
Everybody's got their preference, but the chicken and the poultry, it's important to make sure to have wild or pasture raised poultry. You want them out doing what they need to do and to eat what they need to eat, not what some man decides that he's going to feed them. And usually it's grain to make them big and fat. I have a picture I should show you from quite some time ago. It was the 50s, and they had a certain breed of chicken. And you have a picture of it, and they show that same breed of chicken by today's standards, and it's almost double the size and weight. And it's because of what we're feeding it. We have manufactured and engineered our meats to be big and taste great. I mean, I got to tell you, the meats of today taste way better than the meats of yesterday, but there's a problem there.
But taste is what we eat for.
Exactly. Well, hey, I mean, I'm not going to use brand names, but a current brand name bird of today, I could sit down and eat the entire thing all by myself.
We're not talking about a Cornish game hen.
No, we're talking about the full size, right?
A full size chicken.
Sure. So I can go ahead and I can eat one of those completely all by myself. Well, the bird that is grown right, I don't want to eat the whole thing. It doesn't taste as good, which is wonderful. What a great thing. You're only eating a certain amount. And so it's great. I might have half a breast or a couple chicken legs or a couple thighs, and I'm good to go. I don't want any more.
Yeah, but if it doesn't taste quite right, then I don't want to eat it at all. I mean, one of my problems is that breast tends to be very dry, and I like something that's more moist.
Yeah, I'm not saying they taste bad. It's just not quite as good because you're dealing with engineered meats. Right on the other side. I don't want engineered meats. I want natural meats so I get the proper omega-3 to 6 ratio.
I see. Got it. Let's focus a little bit on carbs. Carbs enter the body and are broken down into sugars, if I'm not mistaken, correct?
Yeah, and it depends on the carbs, but when we're talking about sugars, they get broken down into glucose, and we have a problem because that can create inflammatory issues. And that's huge with cardiovascular disease. But here again, we go with the testing. The testing that is being done nowadays for most doctors is really out of date. They're looking at just cholesterol as a predictor of cardiovascular disease when you have to look at LDL, its density, and its size and its buoyancy, and HDL and IDL and VLDL. I mean, there's so many things to look at. And you also have to look at inflammatory markers, which are huge. And I mean, when I'm doing cardiovascular testing, I'm looking at so many different things, not just the 3 or 4 that most doctors run.
And what about scans, heart scans and coronary artery scans of the chest, as well as cardioid scans in the neck?
They do carotid scans, and all those scans are wonderful. But what they're going to do is show you what's going on here and now. They're not necessarily good for how you should live your life, right? It's usually when you had a crummy life that that those tests become important. But if you do all the right things and you look at the testing and you make adaptive changes when you see a problem with testing, it could save your life. And you have a carotid problem. You got a real problem. Now what? Now you have to have a carotid roto-rooter job, or who knows what, right? I mean, and that's the arteries that they can get to.
And the ones in the neck, the carotid arteries, feed the brain.
That's what I'm saying. Those are the ones they can get to. What about the ones they can't get to, right? So we have more of a problem with that. And testing is really, really huge. It's so important. It's got to be the right testing. And so, and back to fats. Fats are great for you. They're great energy. They help you absorb minerals and vitamins. They reduce inflammation. All your cell membranes are made up of fats. Your nerve sheaths are made up with fats, your hormones. It helps with blood clotting and muscle movement. It helps maintain your body temperature, protects your organs from impact, some of us probably more than others. And basically, you have to understand your brain is about 60% fat. So you start reducing fat, we may have problems not even with brain tissue, but hormones and nerve cells and basically cells of the body.
So if our derriere is packed with fat, maybe our brains are as well?
Well, yeah, I don't know about that, right? So, I mean, it's eating fat and being fat may be two different things.
Gotcha. There are good carbs and bad carbs. You and I have talked about sweeteners, sugar, and stevia. And I have a problem in general with stevia because I do not like the taste personally. Stevia comes from a plant. Sugar comes from a variety of plants. However, cane sugar is thought to be the best kind. It's also a plant. Is there a difference between stevia and cane sugar?
Well, yeah, there's quite a bit of difference, right? I mean, there's so many toxins and poisons you can get from plants. Just because it comes from a plant doesn't mean it's good for you. So stevia is great because it doesn't do anything to the glycemic issue. So it's not going to raise your blood sugar, which is going to raise inflammation, or insulin, which is going to raise inflammation. So you're dealing with a more natural substance. And there's been research. I wouldn't say there's been enough research, and we'll see what happens over time, but it looks really good for stevia.
If they can just work on that taste. I talked to somebody actually who said that there's a couple of brands of stevia that have some kind of molecule that's naturally attached to it, and it gets rid of the bitterness that some people like me taste when they're drinking or eating a product with stevia.
Yeah, I guess I'm a little different because I really, I don't really care all that much. It's good tasting. I don't have a problem with it. I'm probably not that picky, but I know it's
picky.
Yeah, well, I know it's benefiting my health and my patients' health to reduce their consumption of simple carbohydrates. Now, when you get to complex carbohydrates like the veggies and even the fibers, those are great, and those don't necessarily count. In fact, the fibers can reduce cardiovascular disease, but we have a problem with both reduced fiber and increased simple carbohydrates, and not enough fat. I mean, one of the problems that I see so much with patients is I have a hard time getting them to consume more fat. They all have been brainwashed over the last 30, 40 years that you want to be on a low-fat, no-fat diet with high carbohydrate.
And also fiber is another thing that a lot of people don't get enough of in their diet.
No, and that's just like we were talking about, the complex carbohydrates and the fibers. The fibers are great because they help feed your microbiome, the bacteria in your gut, which helps feed your gut.
And some of us have bigger guts than others. We've talked about this before, but gut health is one of the keys to overall good health.
Absolutely.
Right? And how about gut health, carbs and cardiovascular disease?
They go hand in hand, right? Your gut health is probably one of the most important things that you can do. That microbiome, the bacteria in your gut, really help everything out. So it's really important to make sure your microbiome's healthy. And if you feed them a bunch of sugar, you're not going to necessarily have the healthy microbiome.
Got it. Dr. Celaya, we're out of time, but I appreciate you sharing your expertise. Again, today we're talking about cardiovascular disease and carbohydrates or carbs. And as we leave it, something just popped in my head. We're really talking about simple carbs, are we not? Like,
Yeah, simple carbs, the ones that create most of the problems for everybody, and everybody wants to eat because they taste good and they give you really quick energy.
got it. If you want some more information on Dr. Greg Celaya, visit drcelaya, drcelaya.com, drcelaya.com. Explore, look around. Dr. Celaya has put together some articles. There are videos, there's audios, there's all kinds of great information on your health. And be sure to click on the link that allows you to get a 15-minute free consultation with Dr. Celaya. That's right, a free 15-minute consultation with Dr. Greg Celaya. And while you're checking things out, of course, visit us at latenighthealth.com. Dr. Celaya, we'll see you next time.
Thanks, Mark. I hope you have a great day.
You too. Bye-bye, everybody. Have a good week.